Alright, so the babies have been delivered. 4:27. 4:27. Baby A came out first, and she was so long. And then like 2 minutes later, baby B came out, and she was long too. I had no idea how long they really were. So it was like 10 minutes. I came into the room, and just wow. The whole team of people, experts. No, they knew what they were doing. But it was like 10 minutes later, both babies were out, and she'll be back in the room in 20 minutes. Oh my God. I think maybe we'll pop a picture up here. And I'll update you guys after Janelle's back and she's feeling better. Alright? Crazy. These twin baby girls came way early. 29, going on 30 weeks. So, really crazy. Okay guys, quick little update. Janelle got back a while ago. It's probably been a little closer to an hour, and it's 1:20 right now, and when it gets to like 2 o'clock, the nurse is gonna take us up to the NICU where the babies are, and we'll get to see them. Right now, Janelle is out. She did such an amazing job. She did so great. Say hi.
Okay, if you can press 11, that'd be perfect. Thank you.
How you feeling? Tired?
Buzz in. That's okay.
You see the thing? Here they are.
Protecting them from the light right now with those over them. Let's see. I can wall in that for you. Congratulations!
Thank you.
Thank you. Okay.
Yeah, we're doing lines and stuff, sorry.
Wow. It's okay.
Yeah, I'm gonna find the nurse because I don't want to, do anything that I'm not supposed to do to babies, so I'll find the nurse. Yeah, because the top is sterile. The top of the baby, they're sterile.
Okay. Yeah, so that's why I don't want to touch anything.
Trying to pull that up really quick, but right now you can't touch her because of those lines. They're sterile, okay? Natalie, where are you? You can come over here and take a picture if you want.
Okay. Yeah, I don't want to reach over.
How do you spell her name? This is B, yep.
This is Letty.
Letty, Lettie.
Lettie.
I. Okay.
Wow. Amazing.
About to change those in a couple of minutes, and once those fluids are all done, then we can take the drapes off.
Cool.
We have to change our lines. It's a sterile procedure to put them in because we don't want them to get an infection or get sick. And it's a sterile procedure when we change our fluids over as well because they're central lines. And they go through their belly buttons. They're the exact same as what you would have in your arm for a little IV. They just go through their belly buttons.
Cool.
She's on CPAP, so that's like just some pressure to keep her lungs open.
Yeah, she's kind of facing the other way.
Okay guys, today is April 28th. It's like almost 9 o'clock in the morning. How are you feeling? We are officially parents of Irish triplets. Pretty much. I think that's what they call it.
So early.
So our twins came yesterday at like 11:30 at night. And Janelle did amazing.
I already got up once. Got a little bit dizzy in the beginning, but it didn't rush me. It let me like sit down and wait for a little bit. I'm so itchy because of anesthesia and stuff. And
That's like how I feel with my hair probably.
probably, but I'm like itching all over the place. Nah. And I'm wondering when we can go see babies again.
Anytime, they said.
Don't show me like that.
They said we could see the babies anytime. We saw them twice already. Once when they were delivered. And then, which was really quick because they wanted to make sure they were checked out and stabilized and everything. Which they were, thank God, and everything was great. And then we went and saw them again at 2 a.m. and everything was good. So we're gonna check in today again, and yeah, so happy. I'm back at the hospital with Janelle now, and it's 12 o'clock about. And how are you feeling?
Actually, I'm feeling a little nauseous.
Nauseous? Do you need something to throw up in? How about that? Oh, you have bags? Oh, okay. Well, maybe not point the camera in your face then if you're not feeling so good. Okay, so Janelle, I think, is about to take a nap, and at 12 o'clock, they're going to let her get up, right? So she'll be able to get up, walk around a little bit, actually use the bathroom herself for a little bit, and, I don't know. We're going to go see the babies, yeah. We're going to go see the babies. They're on the 11th floor, we're on the 8th. Last time we saw them was 2 a.m.? We saw them at 2 a.m. and they were great. Everything great. Barely needing any oxygen or anything like that. Anyway, I think the overall experience has been completely the opposite that we had last year. And it's been amazing. I know that you felt pretty crappy yesterday and you're still... Yeah, but I think overall you have less bleeding. It was like way more, maybe not comfortable, but fast.
It was really fast, yeah. Like, they brought me in at 10:20 to the OR, and then at like 11:30, I think.
They brought me in at like 11:20.
Yeah, and then 11:30 or 40, babies were born. They stitched me up at 12:20. I was back in my room. But they brought me to OR at 10:20 just as a precaution. And I was waiting for another like 20 minutes for the doctor. Then I was talking to her for another 20 minutes. So that took another like almost hour. So the C-section itself was like an hour around too.
Yeah, but actually getting the babies out was like 10 minutes.
Yeah, like 10-15 minutes, seriously.
And then everything else, the cleaning up and everything, that was like 45 minutes.
Yeah, then they gave me some kind of 2 injections in my belly to like numb it up or something,
and then the biggest difference for postpartum between last time and this time was that your uterus was soft and it didn't compress and stop the bleeding. That's why you had a hemorrhage last time.
Right away to make it shrink, and then they put IVs too right away. They were really good.
They were amazing. I felt completely comfortable in there.
Okay guys, we're on our way to our babies. I'm in the chair. Joe's pushing me and bumping into everything.
I was saying I'm definitely not cut out to be a nurse, but I'm trying my best here, so.
The lines in her belly button just help give her the fluid nutrition.
Hi, baby. This is wow. Want help getting up, or?
I can get up, I think.
Okay, I'll back up this thing.
So, Caitlin is taking care of Letty. She's on break right now, but I have Charlie
But if you have any questions, they're twins, so a lot of what's going on is the same thing.
Say hi. Can I walk around?
Yeah. Here, I'll lift it up so you can see her.
So tiny.
Mm-hmm.
Oh my goodness.
Her feet, her toes are long too.
And
Say hi to Letty.
Hi, baby.
Wow, she's kicking. I had a question about the skin color. Like, is it normal for prematures to kind of look red like this?
yeah, so yes, you can. No, you're okay. I know it's like hard to know. Like, can I do this?
No.
Yes.
Your hands are clean, right?
Yeah. Oh, it's so warm in there.
Yeah. So that really red color, they'll be like that for a little bit, and then they'll kind of pink up.
Okay.
Less pink.
I was really concerned about the redness, like
Yeah.
if that's
Sometimes,
normal.
Have you heard of bilirubin before?
Yeah.
So premature babies and even full-term babies sometimes have like a high bilirubin level, and sometimes it shows in premature babies as like being more red than yellow.
Okay.
But
Yeah.
both of their levels, I think, were okay, but we're gonna keep checking for a few days.
Yeah, I see her feet.
Those are.
She has a long foot.
Oh, it's so nice.
Yesterday I saw like her fingernails and stuff. It was really cool.
It's so soft. It's so soft.
It's really crazy because she doesn't have like a lot of body fat, right?
Yeah. They have a good amount of hair though.
Yeah, they were giving me really bad
Were they?
heartburn.
Do you remember if Romy's hair looked like this when she came or no?
Yeah.
Because her hair color, they both look a little darker, but Romy's hair became lighter, like
Oh,
almost
yeah.
my hair color. Romy's our 14-month-old at home.
Oh, okay.
Oh gosh, the diapers are so tiny.
I know.
Yeah.
They're like even smaller than you.
Than the one we have. I don't think I've seen these ones.
Yeah, here.
Oh my god.
Back downstairs.
Look at this. Yeah, the ones we have at home in the nursery are like double the size of this.
I know.
This is crazy. That's what's on her now? Continuously getting stuff, or?
Yeah, so there's 2 little lines in her belly button. One is monitoring, that's the red waveform. They're monitoring her blood pressure.
Mhm.
They use that line for any type of blood draw. She is so far very stable, so as long as she remains stable after her labs at midnight tonight, that can come out. And the other one is giving her some nutrition, and that will stay in. That can stay in for about a week, and we'll kind of get her going on feeds and make sure she's tolerating it. And as she tolerates more in her belly, then we'll go down on the amount of nutrition she gets through that line.
Yeah, and someone came and talked to us about donor milk.
Yep.
And I think we told her, yeah, we're good with it, so.
Okay.
Do we need to sign something, or is it just a verbal consent?
I think it's just a verbal consent.
Okay.
How come their nails are like dark?
Just because they're so premature, I guess.
Really?
Didn't have the chance to change color. It's the same with their skin color. I mean, the same reason.
Look at baby. This
Trying
is Charlie.
Hi, Charlie.
Hello, Charlie. You have long toes. They go sleeping. There's Lottie and Lottie have long toes too.
They have your long toes.
Yeah. Oh, hello, Tiny. You're so sweet. You're so sweet.
Hmm.
And long fingers too.
It's amazing, right? She's definitely bigger than Letty.
Yeah, she is. She's so Asian. So funny.
It's really crazy. Here's all her vitals, right? Says Kismetova girl A. But this is Letty. Oh no, this is Charlie. Oh my god. I'm already mixing them up.
How are we gonna know who's who?
We're gonna put a marker on their elbow.
Tickle, tickle, tickle your belly. Tickle, tickle.
Oh, don't tickle her.
You just sanitized your hands, don't worry. Let me get you. You're scared to touch them?
I just don't want to have too many fingers on them, that's all.
Come on, we're their parents. You should get exposed to our germs. You're holding her toes. I mean, she's holding your finger with
I
your
know,
toes.
she's already loving me like Romy. Hi. So we're up at the NICU and we just wanted to show what they have on the wall up here. It's really cool. They have all these different babies in the different weeks that they were born and how old they are now. Really, really cool. These were triplets.
Wow.
31 weeks.
The boy had to stay here for 65 days.
Wow. That's 9 weeks, right? Wow. So that gives us something to think about.
So guys, we got our dinner. I got a stir fry with rice and a bunch of vegetables. I got also corn, some mashed potatoes. What'd you get?
I got a burger, cheeseburger with lettuce, tomato, onions, and fries.
Looks yummy.
Yeah, looks pretty good.
I didn't see the bun though. There's no bun.
There's a bun underneath the lettuce.
Huh.
Open your mouth. Maybe. She gets fed now too. You are something else, girl.
She's pulling on the tubes. Oh,
Cutie pie.
she's peeking.
Yeah, she's like, I see you.
Yeah. Yeah, she's comfy over here.
Yeah, look at her.
She's just hanging. She's hanging out.
Yeah.
Adorable.
They're ready to have their milk or not yet?
Every 4 hours she gets some, and she gets some every 3 hours.
Okay.
Yeah. Then as they progress, we do rounds on every patient in the NICU. So as you can imagine, with so many patients, rounds goes for hours and hours sometimes. And we discuss each patient in detail. I don't know if the doctors will decide to increase their feedings. Oh, cute.
Oh, hello.
Oh, listen to her.
Hi.
You still have family
Hi.
in Kazakhstan? Yeah. You probably don't get to see them very often.
Well, my mom was able to come for New Year's Eve.
Oh, nice.
And they stayed here for a couple of months. Yeah.
Very nice.
It's okay, it's okay. I'm quite okay. Yes, I know you're so strong. You're strong, baby. You're funny. Do you want to pick you or not? There you go.
So they're basically 30 weeks old right now.
Yeah.
Well, I guess you can call them 1 day old now. It's really interesting. Okay, today is Thursday, April 29th.
It's the third day we're here.
We came here in the morning on Tuesday for a checkup and a shot. And then we had the babies at like 11:20 on Tuesday night. So full day yesterday, and now today it's 1 o'clock on Thursday, and we're going home, which is amazing, especially for a C-section, right? So anyway, we're about to enjoy a really nice lunch.
Camera's dying.
So we're gonna go, because the camera's dying. She's getting a tan.
And she's eating.
Yeah.
And her tubes are out of her nose.
Oh yeah.
All the way out.
That's okay, they're still blowing. Her arms are like under her. She must have been really pulling stuff. They're like, okay, you're getting your arms underneath your thing.
That's my stuff.
She's got her tube in her too. I think they're both eating, yeah.
You ready to go home?
I'm ready to go home.
Me too. I'll feel so much better once we get home.
I would also be okay if you had to stay, but just want to support you.
No, I don't want to stay.
Check this out.
I have all our bags ready. They got me a ton of stuff for pumping. Nice. And,
Alright,
yep.
everything's packed. Just need to get up and go. Can you believe
We're
it?
going home. I can't wait to see Romy. Miss her so bad.
Yeah, I'm just worried about how she's gonna jump on you.
She's not gonna jump on me. She knows.
You're kidding? She jumped on me when I came home. She was so happy. Oh my god, the camera. We need to get like we need to like make a specific camera mount for our car, you know?
Yeah, we do, because this car is
We're
great. And
we're legit.
So much better than Beamer ever was with this camera, and my Lexus ever was with this camera.
Yeah. So, and I don't want to just hold it while I'm driving. Yeah.
So we're going to order dinner. Order it out, right?
Yeah, we're getting pizza for dinner, our first meal back, which is great. And we're probably also, at least I want to have like a toast or something. I know maybe you shouldn't, I'm not sure. Maybe just a sip. But either way, I'm like, we're celebrating tonight. I'm so happy. The babies are in the NICU, which that's not something to normally be happy about, but they are doing amazing. They're doing amazing. I don't know what it was. Your body just wanted to be done, I think, with the pregnancy. So there's nothing you can really do about that. If you're dilating and you're progressing,
And then we're trying to
you can't stop it.
and stop it with pills and everything, but nothing works.
They were saying there's a ton of different reasons, like you could dilate early and go into preterm labor, which, you know, and not most of the time, but a big reason could be like an infection or something. They tested and screened for all of that. Yeah, you had no infection traces of, and the babies are pretty, you know, pretty safe to say they don't.
Lucky, yeah, because babies came out really, like, actually, even though they are premature babies, they are still developed enough to breathe on their own. They have sucking reflexes. They have grabbing reflexes.
Yeah.
They are just awesome.
Yeah, they're sucking on binkies already. Like, I can't believe it. And they're little tiny 30-week-old babies that I'm just glad they're in such good care and that you can rest and really prepare for when they're gonna come back, you know?
Yeah, and by the time they're ready to come home, I will be fully recovered from my C-section. Nursery will be ready, because we still don't have that ready. And I don't know, I feel like it's working out the best way it could have possibly worked out. Right? It's still too early to say, but we'll be visiting our babies every day and
Yeah, that's the goal.
calling them every day.
The goal is every day. Like, I'm thinking we should call them tonight.
Yeah, we should, and we will. Because, I mean, they're there, and 24/7, somebody's there watching them. We will be bothering them. I feel like this time around, compared to our first labor experience, we were more experienced, and we knew exactly what we wanted, how we wanted it to be.
Yep, we didn't let anybody persuade us, even though we really took in all the information that we could, to understand the situation.
And we talked about everything, and we were just reasonable.
That is my biggest piece of advice to anybody. Even though we've only done this once with C-section and once with natural, I think we could say now, like, don't let the medical staff choose for you.
Yeah, or push you into it.
Yeah, even if you just, for some reason, I just think your right to choose, and yeah, listen to everything they tell you, and then decide for yourself. Don't let them push you into something.
Right.
And even if you're not comfortable with it, don't. It's not like they were pushing us anyway, but
Well, there always are doctors that are really pushy and that are like trying to scare you to make you make a decision towards something that they are more comfortable with, you know?
Yeah, so here's an example, and it's not like the doctor was crazy pushy, but she was making it absolutely clear that her medical recommendation the first time we went in, which was Monday, was to stay overnight. And she was 2 centimeters dilated, and there was really no reason she felt to stay overnight, even though the doctor provided a ton of reasons, which were probably all legit, definitely are. So anyway, we went home, and that was our choice. And then the next day we came in for the second dose of the steroid shot, and she was 3 to 4 centimeters dilated, which was, you know, a surprise to all of us. But then 3 hours later, they checked and she was 5, and it just progressed all day, even after the muscle relaxers or whatever they gave you.
That was really bad.
Which also was magnesium to help get the baby's brains protected, and apparently
There was just so many things that were trying to keep the babies inside me, to keep me pregnant, but nothing worked because my body was just, I guess, over it, and it just kept dilating and dilating. No muscle relaxers, no pills, nothing helped to stop the contractions and to stop the dilation. So another thing is that almost from the beginning we were thinking about doing a C-section, because there were 2 babies in my belly, and we didn't want to risk one getting stuck, like her head getting stuck or getting her pulled out by her feet. That was just out of
that's scary to think of.
That's scary. And some doctors were coming in, pushing us into labor, into like natural labor, saying that, oh, it's okay, we'll turn them, we'll pull them out, and that's not what we want for our babies, and that's not what I want for myself to go through, right?
Yes, but one of the doctors that did really recommend natural instead was actually, I think, a resident. So yes, they're residents, they're pretty much doctors at that point, but they're not as experienced as the other doctors that are there, like Dr. Kohari, who was like so cool with us choosing to do a C-section. Really cool.
Even though she wasn't the one that did it.
Yeah.
So our doctor her name was Daisy, and I never seen her before. Nowadays they make everything so complicated. There's like million people that come into your room, million doctors that you talk to, and I don't know, it's just too much to take in, especially when you're under stress.
Yeah.
Under magnesium IV. I was so miserable to them.
I swear the first day that we stayed all day, which was the day that we came in for the second shot, I swear we met like 5 to 6 different, I don't know, 5 doctors, but
teams.
5 to 6, teams. There was multiple different teams coming in and out, and I guess it was because she was passed off to a high-risk team, and it just felt like we had to explain her story every
again and again
hour.
and again.
It was
and again.
crazy.
It was so annoying, and I was so hot. I was overheated from that magnesium IV. I was just, in the end, I was so miserable.
Yeah.
Like, I don't want you touching me.
Yeah, you were getting snappy. Yeah, but that was okay. It's okay. They understand it. They were literally telling us, like, this is their job, you know. They understand they see this day in and day out, how people are feeling, and
Yeah, and then I talked to the doctor that was in the OR already, operation room, and I told her all my concerns about my first labor, how it went, that I lost a lot of blood, that I'm uncomfortable without having bags of blood ready for me. And they had 2 ready, but they didn't even have to use it. And she was so cool. She was just the best doctor ever. I wish I could see her every single time, but I know that she's just a doctor who does the C-sections. She doesn't like follow you through the pregnancy, or I don't think she does. Maybe she does. I don't know. It's so confusing nowadays because they don't do everything in one hospital. Like for blood tests, I had to go one place. For ultrasounds, I had to go to a different place. For this and that, I had to go to a 3rd place, and it's just so annoying.
okay, go very careful, and if you need help, just stop and let me know. Oh, we're home. There's no place like home. Hi, Romy. Hi, Romy. Mommy's home. Oh, baby. Come here. Come here.
Sit down. My baby. I missed you so much. My boy. Alexa.
Hi. You left that on her nose. Careful, Mama. Careful. You're overdoing it, I think. Careful, Mama.
Okay. I missed you so much.
Okay. Careful. Come here. Okay.
My baby. Yeah. I missed you.
Little monkey.